Whoop, got it. Live stream. Okay. Welcome, everyone. And I will start. I think we're going to be sharing some screens. And so, reminder, recordar para todo mundo, vamos a empezar a oír las presentaciones de los estudiantes de Exeter. Y entonces vamos a tener un tiempo y después vamos a dar comentarios y preguntas y después vamos a votar. So just a reminder, everyone, we're going to hear the presentations by the Exeter medical students on their business case. We'll be able to do comments and questions, and then we'll be able to have a vote. A vote, yes, a vote on if we would fund the proposal. So I know Jesse is helping us with the slides here. And then—
Are you able to see the slides?
I see, let's continue.
Yes, perfect. We're going to continue with let's continue.
We have a couple. I've just had an email from one student who is just in some training who can't make it. So at the moment there are two here who are going to present, and then another one he should be arriving relatively soon. So okay, perfect. Just to let you know.
Okay. So if we get to the slide where a student is not there, just let me know, and we'll switch to the next one, and then we'll come back to that when we're ready. And for all the Exeter students, I believe Dr. or Professor Saulsbury mentioned you have 4 minutes for your presentation, and I will be timing because I know we have a very, very tight schedule today. So I will be timing everyone at the 4-minute mark. You will hear me slightly interject in a very polite manner to let you know that it's time to either cut it short or wrap up in the next 30 seconds. So I'll keep that going. And so the next presentation is pollen warning system.
This was Amy who can't make it. She's
Okay.
the one who's emailed me, I'm afraid, so really sorry.
Next, the breastfeeding support. Who has this one?
Hi, that's mine.
All right, Elena, go ahead and start sharing your screen.
Okay, it might be longer than 5 minutes. I'll try and whiz through it.
She calls on me.
Okay, can you see my screen, everyone?
Yes.
Yeah.
Go ahead,
Okay.
Anakin.
It's just whirling, sorry. Sorry, my computer's just frozen while it's figuring out what it's doing.
No worries, no worries.
Oh, there we go. It's up. Okay. So my name's Eleanor. I'm a third-year medical student. And my project is a project aiming to improve the rates of breastfeeding in Barranquilla in Colombia. So the reason I've chosen this subject, so it's a problem in Colombia. The most recent data I could find by the World Bank in 2015 found that only 36.1% of women are breastfeeding exclusively at 6 months old. And breastfeeding practices haven't actually improved over the last couple of years, and they've consistently. And in the hospitals in Colombia, although there's been efforts to introduce the friendly breastfeeding hospital initiative, out of 51,000 hospitals, only 330 were accredited to be breastfeeding friendly. And a study I looked at in 2019, which looked at some of the kind of barriers around exclusive breastfeeding in Colombia, it was in Cali, in Colombia, and found that knowledge and skills amongst mothers were poor, which meant that they didn't feel confident in breastfeeding. So a lot of women didn't know how to express their milk at home. They lacked any knowledge in kind of the basic skills around breastfeeding, and also the recommendations for breastfeeding as well. So although women intended in this study to breastfeed, the reality was that at 6 months, most of them weren't, because of their lack of kind of support. As Colombia has in the past made an effort to promote breastfeeding. There's a 10-year plan in 2010 to strengthen programs, but there's still a lot of gaps that of support on offer. So a package of interventions is really needed to strengthen the coordination around breastfeeding. So including support, counselling, and also promotion around what the recommendations are. As you can see in this slide, looking at policy and programs in 84 countries globally, Colombia ranks very lowly on the scale. So it's 100 is doing really well. And as you can see, Colombia is in the kind of low mark around 48 on a scale of 48. So there's a great deal of improvement that can be made. And there's a lot of good reasons for promoting breastfeeding. It's really important. It has a number of health, social and economic benefits. So it protects against breast infections. It supports healthy brain development in children. Also prevents children and adolescents from, or it's they have a lower risk of becoming obese if they've been breastfed. Children are more likely to perform better on intelligence tests, and also it reduces the risk of ovarian and breast cancer in women as well. So the goal of my programme is to improve the rates of breastfeeding in Barranquilla. And this is through a multifactorial approach. So firstly, through a communications campaign. This will focus on the benefits of breastfeeding, recommendations, and the support available. And it will be primarily through social media, Facebook and Instagram ads for the service on offer, and also recommendations. And this will work because the 69% of people in Colombia use social media, and this will be higher for the younger generation. And we'd also use a poster and campaign in primary care and hospitals. There'd also be a peer support service. So it would involve training up peer support workers and an app. So workers would deliver support to women through video. And this makes their time more effective, but also it makes it more accessible for the women. And it's been something that's been used in the UK for breastfeeding projects since COVID.
Pardon the interruption, you've got about 30 seconds. Okay.
So the project would be in these 6 hospitals in Barranquilla, focusing the starting up the breastfeeding friendly hospital policy initiative. This would be the structure of the project. So there'd be a project manager, 6 peer support workers, a communications campaign, and then the hospital accreditation for breastfeeding, being a friendly breastfeeding service. These are my outcome measures, which I won't have time to go through. And this would be my funding plan. So it involves the cost of a full-time project manager who would be trained as a nurse and would deliver training in the hospitals and training for the peer support workers. It would involve smartphones for the staff. I would expect 8 hours a week from the 6 peer support workers, a cost of app development, meeting room for the training for the peer support workers, leaflets and posters and training booklet, printing costs, social media adverts, and then a peer support recruitment campaign would bring my project to a grand total of this amount in Colombian dollars, £82,000 in pounds, and then 109 US dollars. So these are my references, and thank you for listening. Please welcome any questions that you might have on my project.
Okay, thank you. Great job. Queremos ahora abrir para preguntas o comentarios. We want to open up the time now for any questions or comments. Oh, we have a hand up. Do I have a hand up, Jamie?
Sorry, I was just estudiantes de Uninorte, miren que este proyecto es Barranquilla.
Mhm.
I have a quick comment. Fantastic presentation.
Mhm.
Good job. The slides were, I think, well put together. You didn't include too much information on them. It was easy to understand. They were in Spanish and you were able to communicate the same information in English. I would say overall it was fantastic.
Joe, you have your hand. Professor Joe?
Thank you for your presentation. And as Jesse has rightly said that the slides were good, presentation was clear. However, for those of us who are non-Spanish speakers, we may find it difficult to clearly see whether some of the things that you put on the slide, we may find it, so we may need to struggle with some of those things because I'm not a Spanish speaker. So that's one. So maybe, instead of putting everything in Spanish, since you are speaking to non-Spanish speakers also, maybe some of them should have been translated into English language. That's one. Then number two is that some of the papers that you quoted in your work, they were 2015 and 2010. My question is that have you found out how much work has been done between 2015 and 2021, if not 2022? Let's assume that 2022, maybe some of them might not have been published. So probably that if you do some preliminary background work, some of the things that you want to do, probably some of them will have, maybe they're already in place. So you need to look at that so that you don't work with the whole statistics, although you quoted figure of 2019 policy, but before research finding could be translated to policy, it will have taken some time. So I'm looking at that time lab between the data that you're establishing your study upon and the current situation. So you need to be careful about that. Thank you.
I want to, in the chat, we have a question from our student, Alexa from Uninorte. Her question is, how would you change the mind of many of the mothers, especially first-time mothers, who are not going to even try because they're not sure, they don't have the information, they're concerned. What she says here is that they don't know how to do it correctly. How would you change their mind?
So part of the program would be actually training the staff on the maternity wards in the hospital. That would be kind of one of the key parts of the training. So the nurse project manager that would be running the project would deliver training twice a year for ward staff, and they would, in order to upskill those staff to pass on the knowledge to the women as they come through and before they leave, and also promote program too. So if they go home and they struggle, they've got someone to turn to.
Thank you. Entonces, respuesta, voy a rapidito, sería entrenamiento a todos que trabajan en el hospital para que puedan apoyar a las madres y dar la información y educación. We have another question in the chat box. This question is, excellent presentation. In Barranquilla, we have many clinics and hospitals of different levels of care and risk who provide care to in the perinatal maternal area. But none of them are accredited as this baby friendly. So that's why it's very important to provide this education and this focus. I would just add that your proposal is for the telehealth and to start in moving towards achieving the certification as a starting point. That's what I wanted to clarify, if it included achieving that baby-friendly status.
Yes, it would also say part of the project manager's kind of role would be to initiate the baby-friendly hospital policies in the hospital and the training in particular, because those are the kind of bigger sort of parts of the baby-friendly hospital initiative that would take more work to get going.
Yes. Okay. And then I'm going to summarize it and translate it. But I would say then the other part I think you need to also consider is the sustainability of it, which is, the long term is keeping it going once it's going. That's usually one of the hardest parts, is not only just getting it going, but keeping it going through and providing the support, especially in that last step, the outreach support. So, pregunté si la propuesta incluye fondos para ayudar a los hospitales para que adquieran la asignación de ser amigable a la familia, a los niños, y dice que la presentadora dice que sí. También yo le idea que es importante que esto esté puesto para que lo mantenga, para que se mantenga, no solamente iniciarla, para que se pueda mantener los niveles que es necesario para mantener la designación. Any other questions or comments? ¿Alguna otra pregunta o comentario? I think we're ready to vote.
Okay, we're going to vote. Please make sure to go to the website and cast your vote.
Let's see. I think last time we put the link to the, okay, perfect.
So the link is here on the top if you can't find it. olev.com/Jesse Casanova 654 and cast your vote. Aquí está de nuevo la página web para que la puedan ver y puedan votar. All right, Eleanor, you got a good lead so far. All right, another 10 seconds, otros 10 segundos. All right, so here are the results. As they're still coming in, I feel like a CNN reporter. All right, Eleanor, 56% would fund you at 100%. And 47, well, that's now 53 and 47. 47 would fund you at 50%, and there are no people that would not fund. So overall, fantastic.
Fantastic.
All right, we're going to move to the next, mouth care and stroke.
I think this is Pablo's, and he was going to be arriving a little bit late, so I don't think he's here yet. So
okay, we can go to the next.
Yeah, so I'm just keeping an eye on the participants. So when he's here, you could maybe go to Harris first.
What about zinc deficiency in children?
Yeah, that's mine. I'm just gonna quickly upload it.
All right.
Ivonne. Y Jessy, disculpen, es que a las 10:30 está
sí,
la actividad, entonces sugiero por disponibilidad de las personas que se pudiera realizar la actividad de lúdica, ¿verdad?
So we do have an activity at 10:30 Colombia time, 11:30 ours, and I believe it's 3:30 Exeter time, UK time, not Exeter time. Anyway, so if we can move to that activity first, and then we can come back to this.
Gracias. María Gabriela. Pues ahí están.
I hope you guys are ready to dance.
Hi, everyone.
Hola.
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 Well, my name is Ana Maria, and I'm from the international office here at Uninorte. So right now we're going to start with the activity with a brief introduction of what we'll have. So I will start sharing my screen. And I will let the microphone to Estefania and to Emily, which are the students that are going to make the presentation. Can you confirm if you can see my screen?
Sí.
Okay, perfect. Okay, Stefania and Emily, we can start right now.
Ana María no se escucha.
Jesse, is there something that has to be pressed, like to share audio when you share the screen?
I think it should do it immediately.
Yes, I already, well, I think I put share sound,
Okay.
but yeah, one of the students had an inconvenience with the internet. So, well, we're going to start right away. So I will let Emily start and I will compliment her.
Okay, my partner is having some connection problems, so I will ask you please forgive us a minute and she will join immediately.
Yeah, that sounds good.
Okay, so I will start. Hola a todos, es un gusto conocerlo. Mi nombre es Estefanía Gualtero y bueno, junto con mi compañera Emily, ambas somos estudiantes de Global Peers, el cual es un grupo de estudiantes Uninorte que apoya a los estudiantes internacionales durante su movilidad internacional.
Bueno, el día de hoy, well, as Stefania already said, Emily, who is the one that will going to start the presentation in the minutes, she is also a student of the Global Peers here at Uninorte, which is a group that supports the international students during their international mobility.
Bueno, el día de hoy les tenemos una actividad muy divertida que está relacionada con el Carnaval de Barranquilla. Entonces, antes de empezar, me gustaría saber si alguno de ustedes ha escuchado algo de este evento.
So today we have a very fun activity for you that is related to the Carnival of Barranquilla. Before starting, we want to know if anyone has already heard about this carnival.
So you can comment on the chat or you can raise your hand and talk to us. If you can say yes, I have heard, or no, I haven't.
I have
Sí.
not.
Carnaval de Barranquilla. Jessy, ¿tú?
Yes.
Yo lo había escuchado antes, pero nunca he estado ahí.
Okay.
And what did you think when you heard Carnaval of Barranquilla? What do you think?
I immediately
your
thought of our Mardi Gras we have
Okay.
here.
Okay.
Mhm. Maybe even like in Tampa tenemos Gasparilla.
Ah,
It's
yeah.
like- that might be more. That's kind of like Mardi Gras in Louisiana. Es algo parecido.
Okay. Interesting.
can
Ok,
see.
bueno, muy interesante todos los comentarios. ¿Alguien quería agregar algo más?
No se escucha, si el video tiene audio, no se escucha.
No escuchamos el audio.
Todavía
No.
no.
Esta parte no
No.
tiene audio.
Hasta ahora no.
Okay, so Emily, please explain us what is the Carnival of Barranquilla.
Ok, sí, bueno, buenos días a todos. Como les comentaba a mis compañeros, yo soy Emily Rodríguez y hoy vamos a estar hablando un poco sobre el carnaval, sobre esta fiesta tan importante para los barranquilleros. Esta es una celebración llena de color, música y bailes que expresa la diversidad cultural de Colombia y, por supuesto, la alegría de los barranquilleros.
Yeah. The Carnival of Barranquilla is a celebration full of color, music, dances, which express the cultural diversity of Colombia and the joy of the people of Barranquilla.
Así es, digamos que dentro de esta festividad hay múltiples bailes, pero hoy les traemos los principales, que serían estos.
Okay, we have a lot of dances, but we want to show you today the men dances.
¡Cumbia! Danza de la región Caribe, donde las mujeres con sus polleras cautivan a los hombres. ¡Cumbia!
Ok, bueno, eso fue una pequeña demostración de varios de estos bailes principales. los cuales cada uno tiene un disfraz muy característico. Vamos a empezar por la marimonda. Este es un disfraz auténticamente barranquillero, mezcla de primate y elefante, que demuestra el espíritu del hombre nacido en Curramba la Bella, al que le gusta divertirse sanamente y hacer reír a todos.
Okay, each one of these dances has a very distinctive costume. We will start with La Marimonda, an authentic Barranquilla costume, a mixture of the primate and elephant, which represent the spirit of the man born in Curramba la Bella, the one who likes to have fun in a healthy way and always wants to make everyone laugh.
Luego tenemos la cumbia. Este es un baile de Colombia que se originó en la costa atlántica, en la costa caribe. Esta danza es la fusión de tres culturas, la africana, la indígena y la española, que se combinaron en los tiempos de la colonia.
La cumbia is a dance from Colombia, originated in the Caribbean coast. This dance is the fusion of three cultures, the African, the indigenous, and the Spanish, that were combined in colonial times.
El mapalé es un ritmo afrocolombiano de danza. Mapalé es el nombre que se le dio a un pez de mar que al ser sacado del agua hace unos movimientos muy fuertes buscando sobrevivir. Muchas coreografías se hacen basadas en este animal.
Okay, the mapalé is an Afro-Colombian dance ring. Mapalé is the name given to a sea fish which, when taken out of the water, makes a strong movement seeking to survive. Many choreographies are made based on this animal.
El garabato. La danza del garabato caricaturiza un enfrentamiento entre la vida y la muerte. Al final de cada cosecha, cuando los amos le regalaban un día de descanso, a los esclavizados en medio de fiestas, estos representaban su mundo de infortunio, animándose con tambores y bailes y rituales. Con esta danza, los negros esclavizados no solo se burlaban de sus amos, sino de su propia desgracia, de la naturaleza, del trabajo, de los dioses y de la muerte.
Okay, and last one, the Garabato dance caricatures a confrontation between life and death. At the end of each harvest, when the masters gave them a day of rest, the slaves in the middle of the party represent their war of misfortune, animating themselves with drums and ritual dances. With this dance, the black slaves not only made fun of their masters, but of their own misfortune, of nature, of war, of the god, of death.
Okay, ahora queremos mostrarle cómo es el primer día de carnaval. Se llama la Batalla de Flores y varios artistas y bailarines muestran su talento en este desfile.
Okay, and now we want to show you how the first day of the carnival looks. It's called the Battle of Flowers, and various artists and dancers show their talents in this parade.
Perfecto. Entonces, hoy vamos a vivir un poco de la alegría del Carnaval de Barranquilla con esta clase de baile que tenemos preparados hoy para ustedes.
So today, we're going to live a bit of the joy of Barranquilla Carnival with this dance class we have prepared for you.
Esperamos que se diviertan y se muevan al ritmo colombiano caribeño.
We hope you have fun and move to the Colombian Caribbean rhythm. So now it's your turn. Let's dance.
That's right. So right now we'll let the microphone to our dance instruction, which is Lilian. So Lilian, the floor is all yours. Let's dance.
Hello, everyone. Welcome to this dance class where today we're going to thank you Ana Maria and Estefania and Emily for the information. It's very good instruction of what carnival
No se
is.
oye.
Hello, do you hear me?
Yes, we can hear you.
Okay, as I was saying, Carnival is one of the most important cultural festivities in Colombia, and I hope you enjoy this class. Today, we're going to start warming our body, just with the first and the second song, and we are starting with cumbia, with the rhythm cumbia. Okay, let's stand up. Today I have in my head one of the elements of the dresses for cumbia dance. Yeah, if you look in internet, you're going to see a lot of dancers and people wearing things like this, and costumes, big costumes and big skirts. The dresses are very colorful, and okay, I hope you know a little more of Barranquilla's carnival, and if you want to come and enjoy it by yourself, you're welcome to. Okay, let's start warming our body. Bien. Can I share my music? Yes. Okay, let's start.
Personally, personally, I rock your body. I promise you go home, you won't tell daddy. I give it to you like you never had it. Screaming, church, like speaking Chinese.
I hope you, or I invite you to activate your cameras for me to see your movement and know your faces and feel you more. Okay, let's
start. Personally.
Okay, let's move on.
Personally, I rock your body. I promise you go home, you won't tell daddy. I give it to you like you never had it. Screaming, church, like speaking Chinese. Now waiting me this, back a boom boom. Now waiting I see Saga, but she know one me. She talks so she know one leave. I know go lie, the things within my mind. When I see you dancing, girl, you got me high. And if you wanna try, begin good day tonight. Cause I'm in the mood, as long as you feeling the groove, I deal with you. Personally, I go deal with you. Personally, I go deal with you.
Now let's move our shoulders back.
I go deal with you. Personally, professionally, I see what you're doing intentionally. Yeah, me want it physically, so give it to me radically. Emotionally, psychologically, you're turning me on biologically, sexually, dramatically. And she talks so she know what I know go lie, the things within my mind. When I see you dancing, girl, you got me high. And if you wanna try, begin good day tonight. Cause I'm in the mood, as long as you feeling the groove, I go deal with you. Personally, I go deal with you. Personally, I go deal with you. I go deal with you. Yeah, exceptionally. The reason is spiritually. Money speaking so drastically, magically, internationally. Abatically. Grammar, now for dictionary. Saga, but she know one me. She talks so she know one me. I know go lie. The things within my mind. When I see you dancing, girl, you got me high. And if you wanna try, baby, go date tonight. Cause I'm in the mood. As long as you feeling the groove, I go deal with you personally. 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 I go deal with you personally. Personally. Personally, I go deal with you.
Okay, let's move up. Now we're going to do our pelvis. Forward and back. Keep doing it. Pelvis. Okay, keep doing it. Now we go with
This will be back again. She's making me back like a bingo. And I'm gonna try to be single. And the way that she's dancing, I don't know. She's making me back like a bingo. And I'm gonna try to be single. And the way that she's dancing, I don't know. Cause tonight, I don't care what I will buy. Cause I know we getting high. Put your hands up in the sky. In the sky. Hey, yeah, you got me dancing a lingo. The way that you move in your window. Dancing a lingo. Dancing a lingo. Yeah, you got me dancing a lingo. The way that you move in your window. Dancing a lingo. Dancing a lingo. A lingo. A lingo. The way that you move in your window. Move in your window. Move in your window. A lingo. A lingo. The way that you move in your window. Move in your window. See this girl. The way that she's moving, she's busting my brain. She got me moving again and again. She's feeling my friends. I can never let go. I can never let go. She's making me back like a bingo. And I'm gonna try to be single. And the way that she's dancing, I don't know. She's making me back like a bingo. And I'm gonna try to be single. And the way that she's dancing, I don't know. Cause tonight, I don't care what I will buy. Cause I know we getting high. Put your hands up in the sky. In the sky. Hey, yeah, you got me dancing a lingo. The way that you move in your window. Dancing a lingo. Dancing a lingo. Yeah, you got me dancing a lingo. The way that you move in your window. Dancing a lingo. Dancing a lingo. A lingo. A lingo. The way that you move in your window. Move in your window. Move in your window. A lingo. A lingo. The way that you move in your window. Move in your window. Move in your window. Peace where we back again. This girl they crazy. She couldn't do like say she blaze. She whining and grinding and winding up on this place. She know they play. Now face to face. And she they go. She's making me back like a bingo. And I'm gonna try to be single. And the way that she's dancing, I don't know. She's making me back like a bingo. And I'm gonna try to be single. And the way that she's dancing, I don't know. Cause tonight, I don't care what I will buy. Cause I know we getting high. Put your hands up in the sky. In the sky. Hey, yeah, you got me dancing a lingo. The way that you move in your window. Dancing a lingo. Dancing a lingo. Yeah, you got me dancing a lingo. The way that you move in your window. Dancing a lingo. Dancing a lingo. A lingo. A lingo. The way that you move in your window. Move in your window. Move in your window.
for women and for men. Very good. Very good, very good. Okay, let's start our class, or our carnival rhythms with cumbia. Cumbia has one basic step in your legs. The other steps are changes, or yes, we make changes with our arms. The basic step of cumbia, can you see? Let me change something here. Okay. The basic step of cumbia, or the position, the first position of cumbia is this one. You can place your feet together, one next to the other. Don't close them a lot. Don't open them a lot, just like this. Now you flex your legs in this position. In case of women, you should pose your hands and place them here in your waist. Okay, this is the position for girls. Your back should be stretched, your chest should be a little bit forward, and your chin should be up, like this. Of course, your smile is one of the most important parts of this position, because that's the main expression of dancers. So this is the position for girls. And for men, it's the same position, only that with your arms, you shouldn't do this, but you should like place your hands, your arms in the back and your hands open. It's one of the positions for men, and also this one. Men uses an access or an element that is the hat. This hat, its name is sombrero vuelteado. Sombrero vuelteado is the name of the hat. This is it's one of the most known elements in Colombia, and in this dance, men use the hat like this, but also in the start, when they start the music or the dance, they can place it in this place, in the chest, something like that. Okay? Men start like this, and women start like this. Okay, now we're going to move our body. The movement is like this. You change the flexion and the strengthening of your knees. But you have to maintain the flexions. Okay, you should do this. Tan, 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 tan. And as your legs are flexed, your hips start moving from side to side. Okay? Yes, it's the same for men and women. There is a difference in the men movement, because they have to place the right foot goes a little bit up. You have to put your foot in the tip of your toes. So the movement of the man goes like this. Ta, 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 ta. You have to slice your feet. Ta, 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 ta. This is the movement for men. Now for women, goes like this. Also, placing your feet in the floor. Okay. A very important thing in this dance is when you grab your skirt, we dance this music with the skirt. Now I'm going to wear mine, and maybe you don't have one right now, but I'm going to show you how you should grab your skirt. So the movement is this one. Then you go with your arms like this, slowly and elegant. You grab your skirt and then you open it. When you're grabbing the skirt, I'm going to wear mine. The right position is to make like scissors. Like this. You're making this. You're here, then you go up and down, and you grab it. Grab it. And the right way to grab it is this one. You make it like scissors, like this. This finger should be here, and the other 3 fingers goes like this. Okay? So this is the right position to grab your skirt. Okay? The movement goes then like this, and looks like this. Tan, tan, tan. Okay, when you go with when you open your skirt, your elbows should be in this position, not this one. This is not correct, but this one. This one is the right way to open your skirt. So the movement, this one is one of the positions. This one is another one. You put your arm, one arm forward, and the other arm goes in the back of your head. Try be careful with the position that your shoulders, your arms should be open. Don't do this, please. Don't do this, or don't place your hand in your head. They have to be open. In this position, then you change. Exactly like that. Okay, when we are in this position, the movement should be to the side of the arm that you have forward, like this. Dun, 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 dun. You turn or you move around, and when you change, the turn should be like this to the other side. Okay, you can move around, you can also move around, but when you turn, should be with the hand that you have forward. Okay, and okay, this is faldeo. The name of this position is faldeo arriba, faldeo up, or faldeo arriba. This change of your arms in case of women. Okay, and this one is faldeo abajo. Faldeo abajo. You can do this. Okay, now I'm going with the main movements. You have your head like this, and you start, or you start your dancing, and you open your arms. You can do this. This is movement for men. Okay? You can do this, then you open your arms, and now you move in this position. Your hand should be, your fingers should be closed. They shouldn't be open, just like this. Tan, 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 tan. You can place your hands in the back again, You can do this, tan, 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 tan. Or there are some positions, some movements that you go with the, when you go, you place your hands forward, and then you make this movement. This movement, it's called carrito, and it's next to your partner, next to your girl partner. Then you do this with your hat. You tell your partner where do you want her to move. If you make this movement, the woman moves to this place. If you make this movement, the woman next to you moves to the other side. Okay? Tan, tan, tan. And when in this movement, it goes in like snake movement, culebrita. In this figure, girls do this. Your skirt should be in this position. Okay? So when the hat tells you to move to that side, you do this. And when the hat tells you to move to the other side, then you do this. Okay? It's you move around and always slicing your feet. Now let's do it with music. Music. Cumbia.
A ver, a bailar, lo quiero ver bailando. Ivonne.
If you don't turn on your camera, you are cheating. You need guys to open your cams and we are all
Por su
dancing
fiesta
together,
novembrina.
so come on.
Okay. Let's dance cumbia. Something I was missing. The most important expression or the most important feeling in this dance is elegance, because it expresses cumbia represents the enamoramiento, when a man and a woman fall in love. So it's I mean, this position of men, or this men also always does something like this. Oh, look at me, come here, I have something to show you. And women goes, okay, show me what you got, I'm looking at you. Or sometimes they say, don't get closer, don't get so close, go away, just, I don't want to see you, I don't want you right now. But sometimes they say like, hey, tell me what do you want
Se oye
to...
música.
Por su fiesta novembrina y su santo San Martín, llevamos alegría sin fin hasta sus playas marinas. Y en sus horas vespertinas se mira la mar serena. Luego la mujer morena por el camellón pasea y el negro que la desea. Así eres tú, Cartagena.
Arms up, go down, grab your skirt. And now we're doing cabello abajo.
Lauren y Anton de Jesús en la esquina alegre. baila mi cumbia. Esa nena zaramulla y caramba, con su pollera colorada. Por eso te digo, mi negrita goza y caramba. Con la pollera colorada. Ay, como sandunguea esa negrita Soledad. Con la pollera colorada. Con la pollera, mami colorada. Con la pollera colorada. Con Soledad, yo me voy pa' Soledad. Con la pollera colorada. ¡Ay! Mi tierra linda. Why, hey, yo, Maya, Maya.
Very good.
Mama, el negro está rabioso, quiere.
This one is a slow cumbia. Now we're dancing. Okay. I'm going to show men. I'm going to show men movements with this other cumbia.
¿Cómo vamos de tiempo, Jessy?
Yes.
A las 12:30 nos quedan 15 minutos.
Oh my goodness. Okay, no, let's change. We just have 15 minutes, so let's change to the other rhythm, mapale. I'm going to change my. Okay, mapale. The main or the most important or the basic movement of mapale is this one. That's why we use this movement in the warming movement. It's the contraction. The name is contraction. Okay? Your shoulders goes forward, your pelvis goes forward in the first position, and in the second one, everything goes back, goes this, back, forward and back, forward and back. The difference between this movement or this one is used for urban music. The difference between this one and the other one, or the folk one, is here in mapale we open our hands. Okay, it goes like this. Tan, 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 tan. Always your hands should be open. Tan, 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 tan. This one has variations. Variations are arms up and down, up and down, up and down, up and down. We can do stretch our arms and then mapale into the other side. Stretch and contraction, stretch and contraction, stretch and contraction, stretch and contraction. And we can make it like this. Just contraction to one, looking at one side and then changing to the other side. And 1 and 2. We change faster. 1 and 2 and 1 and 2 and 1 and 2. Okay? The other movement is called revoleo. It's like you're playing drums, like a big one with strength. It's a strong movement. Play the drums. Ta, 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 ta. And with your waist, with your hips, you should make this movement. Like if you're painting an 8, number 8 in the floor. Ta, 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 ta. So this one is revoleo. Revoleo. There's another one that we call like it's like this. Your arms should go forward, and then you change the position of your body and make contraction. And then it's arms and contraction, arms, contraction, arms, contraction, arms, contraction, arms, contraction. It goes with your head down, and with your legs, your legs should do this. Go from one side and then go back to the place you were at the beginning. Ta, ta, and then it's ta, ta, Okay? Now the last movement is this one. We're going to imagine that you have apple trees and you're grabbing the apple. Okay? Grab the apple, 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 grab the apple. And from side to side. And to the right, to the left, to the right, to the left. The movement also goes with your head. Your head says yes. And right, to the left, to the right, to the left, to the right, to the left. Okay? Now let's dance Mapale. Okay, I'm going to make some other movements. Just follow me. There is one movement at the beginning of the song that is called Puntilleo. Marbella, cerca del mar, bajo las estrellas. Negrita, ven, prende la vela. Negrita, ven, prende la vela. Que va a empezar la cumbia en Marbella, cerca del mar, bajo las estrellas. Prende la vela, que la cumbiamba pide candela. Prende la vela, que la cumbiamba pide candela. Prende la vela, que la cumbiamba pide candela. Mapale pide candela, el mapale pide candela. Gracias tambor, ritmo y movimiento. Gracias tambor, ritmo y movimiento. Prende la vela, que la cumbiamba pide candela. Prende la vela, que la cumbiamba pide candela. Prende la vela, que la cumbiamba pide candela. Y ahora nuestra banda completa. Gallina, Mano, Freddy, Tomás. Mapale pide candela, el mapale pide candela. Gracias tambor, ritmo y movimiento. Tambor, ritmo y movimiento. Prende la vela. Now you are Mapale dancers. Okay, let's continue with Garabato. Well, the most important feeling of Mapale is the strength. Movement, as you saw, they are fast and they are a strong movement. This next dance Garabato is more like happy dance. The movement of the basic movement of this or the basic step is the movement of your shoulders. So they go like this. Tan, 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 tan. Your shoulders go forward and back. First you go with one shoulder and then with the other one. Tan, 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 tan is this movement. And with your legs or with your feet, you just make a march. Like if you are just marching. Tan, 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 tan. This one is the simple basic. One of the basics. Tan, tan. And your arms should go like this, like stretching and one, stretching one and then the other one. Tan, 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 tan. And shoulders, everything at the same time. March, shoulders and arms. Tan, 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 tan. Okay? This one is a simple one, but we have another basic step that goes with a, we have to move from one point to another one. So we place the tip of our feet, of our foot, it goes 1, 2, 3, 4. But the fourth step is just the tip with the tip of your foot. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. 2, 3, 4. 1, 2, 3, 4. The music goes tak 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 boom boom tak 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 boom boom. The boom boom is the sign to place the tip of your foot. Okay? Boom boom tak 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 boom boom tak 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 boom boom tak 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 boom boom. When you make the boom, your arm should go up. So the complete movement goes like this. 2, 3, boom boom tak 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 boom boom tak 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 boom boom tak 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 boom boom tak 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 boom boom tak 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 boom boom tak 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 boom boom tak 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 boom boom. Okay? There are some other steps like this one. Okay, now we're going to dance Garabato, and you follow my moves. Garabato. Shoulders.
Buenas noches, presidente. Buenas noches, ¿cómo está? Buenas noches, presidente. Buenas noches, ¿cómo está? Buenas noches, presidente. Buenas noches, ¿cómo está? La danza del garabato ha venido a saludar. La danza del garabato.
Okay, I want to show you a song that has boom, boom, taka, boom, boom,
Música de mi tierra.
taka, boom, boom,
Para que lo vean
boom,
bien.
boom, 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 boom. Now it's long.
Es una balada cena que rozó mi corazón. Es una balada cena que rozó mi corazón. Pego un grito a Salomón. Al salir de esta saquera, pego un grito a Salomón.
Okay.
Que el toro guarda azúcar, los cachitos de panera. Que el toro guarda azúcar, los cachitos de panera. Si yo fuera garrochero, ay, si yo fuera un garrochero, si yo fuera un garrochero, sí. Agua, mama.
And now we're going to change this song. Hey. We're making it. Okay.
Barranquilla querida, el Joe nunca te olvida.
Now move on. Moving forward. Move around.
El torito
Say
remería
hi.
cuando iba pasando el puente. El torito remería cuando iba pasando el puente. Si tú eres perrito bravo, yo soy un toro valiente. Si tú eres perrito bravo, yo soy un toro valiente. Si el toro guarda azúcar, los cachitos de panera. Si el toro guarda azúcar, los cachitos de panera. Si yo fuera un garrochero, ay, si yo fuera garrochero, si yo fuera garrochero, sí.
Now close. In the minute of minutes, go
No me vas a llevar el carro.
Very good.
No me vistas que no vas.
Bravo, bravo.
This was
Bravísimo.
Garabato. Okay. Do we have time for Marimonda or for something like champeta?
I think we're at mark.
I think we are.
I think we're at our finalizing point for this. I think it goes to 12:30.
11:30.
Yeah. Me quedan 2 minutos
Okay.
solamente, entonces no sé
Y
si
es que tenemos ahora otra cosita, entonces.
sí.
Okay. Let's stretch a little for you to not feel pain because the movements. I imagine you're not used to this movement, so you should like stretch a little for the pain. Okay. If you can sit some
My money, my body, now your own.
place where it's stretching a little. Come, let's go. Let's make it.
If I tell you, say I love you, oh. My money, my body, now your own, oh baby. 30 billion for the account, yo. Yeah. Versace and Gucci for your body, oh baby. No do, gotta for me. No do, say that, oh. No do, shakara, oh. No do, gotta for me, oh. Yeah, beauty. My number one in tutu. Sipping bruku tutu. For your love it tutu. I go to go. Biko obianuju. Say you do me juju. Cause I'm feeling the juju. Shake it to you. I wanna dash it to you. You can have it to you. You know I got this in you. I love you, I love you. I love you, I love you, I love you, I love you. There's nothing above you. There's nothing above you, above you, above you. Bridget, you. I like your mini skirt, you. Yeah, you carry fancy, you. If I tell you, hey, I love you, oh. My money, my body, now your own, oh baby. 30 billion for the account, yo. Yeah. Versace and Gucci for your body, oh baby. No do, gotta for me. No do, say that. No do, shakara, oh eh. No do, gotta for me, oh eh. Yeah, yeah, beautiful too. My number one is tutu. Sipping bruku tutu. For your love it tutu. I go chuku. Biko obianuju. Say you do me juju. Cause I'm feeling the juju. And you know say nobody only. But I don't go tell you story. I gotta be your man. I gotta be your man. Let me talk to you. Say a few things. Girl, I'm feeling you. But it's up to you. Say you know I got this. I love you, I love you. I love you, I love you, I love you, I love you. There's nothing above you. There's nothing above you, above you, above you. Bridget, yeah. I like your mini skirt, yeah. Yeah, you carry fancy, yeah. If I tell you, say I love you, oh. My money, my body, now your own, oh baby. 30 billion for the account, yo. Yeah. Versace and Gucci for your body, oh baby. No do, gotta for me. No do, say that, oh. No do, shakara, oh eh. No do, gotta for me, oh eh.
Your favorite boy, Techno on the beat.
Mix monster.
Very good. Okay. Everyone, congratulations.
Bravo, bravísimo. Muchas gracias. Thank you.
You're welcome. I hope you enjoy it. And
Yes,
I
we are
hope
now-
to see you here in Carnival.
We are now
Barranquilla's
professional
Carnival.
dancers.
What, Jesse?
We are now all professional dancers.
Yes, you're now professional dancers. Now you can come and teach everyone here how to dance cumbia and mapale and garabato.
Bravo, que viva el carnaval de Barranquilla.
¡Viva!
And this break and movement and energy is going to help and stimulate our brains and get us all back together again to finish listening to the presentations we have left. Thank you so much for the dance. Thank you, Uninorte. Thank you,
Gracias a todo el
everyone.
equipo de la OSI.
Muchas gracias.
Compañía y todo el equipo.
Thank you, everyone.
Gracias. Feliz
Bye
día.
bye.
Nos quedamos acá nosotros.
Bye, guys.
Bye. Thank you.
Bye bye. It was a pleasure.
Adios.
Now, I think we were waiting, or I'm not sure. I think it was a present. Yeah, the sync deficiency, and then maybe back to Pablo's presentation as well.
Yeah, because he's here now.
Awesome.
Might be quite red in the face like the rest of us.
We're all
Right.
catching our breath.
Mangali, you had the zinc deficiency in children. Go ahead and start sharing your screen. Remember, 4 minutes, and I am starting a timer whenever you are ready.
Don't have energy to present after dancing too much. Okay, so hello everybody, hola todos. My presentation is on food insecurity. I think, yeah, food insecurity and the issue of zinc deficiency in Colombian children. So it's really easy to underestimate the effects of zinc deficiency until we see photos like this. So these photos demonstrate some of the dermatological manifestations of zinc deficiency. So estas fotos muestran algunos de los efectos dermatológicos de la deficiencia de zinc. And why is zinc deficiency so significant? So, ¿por qué es tan importante la deficiencia de zinc? So zinc plays a vital role in the immune, gastrointestinal, respiratory, and nervous systems. And as you can see, it is present in more than 400 enzymatic reactions in 2,000 proteins in the body. And if you have a lack of it, it can lead to growth and developmental concerns in young children and adolescents. And these include things such as growth retardation, stunting, developmental delays, impaired immune systems, and multiple infections. So approximately 4% of the burden of disease in children under 5 globally is due to zinc deficiency, and zinc supplementation has been found to reduce childhood morbidity and mortality. So why is this project needed in Colombia especially? So there was a really important statistic that showed that 49% of Colombian children under 5 have a zinc deficiency, and this suggests that it's a major public health concern in this population group. And a lot of the children and people in general in the rural areas have diets that are mainly based on a high dietary fiber and phytic acid, and they lack animal protein. And animal protein increases zinc's bioavailability, so without it, it can lead to zinc deficiency. As well as this, a lot of children live in low-income households where food insecurity and nutritional deficiencies are widely prevalent as well. And to tackle this, the Colombian government has set up many subsidized nutritional programs to support children. These have been around for 40 years and have been widely accepted by low-income groups as a highly nutritious and low-income, low-cost food. And examples of these include bienestarina and Faronbi harina, which contain mainly barley and eggs. So, however, despite this, only 61% of the poorest population in Colombia have access to these subsidy programs. So in the past, there have been various projects that have worked. One of these most famously includes golden rice or arroz dorado. So it's a rice that had been genetically modified to contain something called beta carotene, which would prevent vitamin A deficiency in very poor areas. And at the time this was first discovered in 1990s, at least 23 to 34% of children under 5 globally had a vitamin A deficiency. And with vitamin A deficiency, you can get eye diseases that lead to blindness. So after this project and a lot of vaccinations and other public health reforms, this percentage reduced down to 2%. So my project is not aimed at producing a food supplement in this sense, because as mentioned, these are widely available and have been used for more than 40 years. But my project's more aimed at increasing public health awareness and ensuring that people in rural areas know about zinc deficiency and how they can tackle this. And so I'm looking for at least £50,000 to enable teaching programs that could help parents know more about the symptoms of zinc deficiency, and hence they can teach more people and so on. And I came up with this figure because I looked at various studies that looked into quality adjusted life years.
Pardon the interruption, you've got 30 seconds.
So this basically is the years of life gained in perfect health. And they suggested that 85% of these public health programs were cost effective with a threshold of 20,000 or more. So this will take into consideration other costs, including leaflets, setting up stalls, teams meetings, and providing a salary to people. So as a result, this will lead to increased job diversity and incomes, higher incomes, so that people can afford and access these supplement programs and know more about zinc deficiency. So thank you very much for your time, and I'm free for any questions.
Okay, thank you. Thank you for the presentation, Harris. So now we open up for comments and questions. Abrimos ahora para preguntas o comentarios para el propuesto. And the chat's not working. El chat parece que no está trabajando, so por favor, simplemente quitan el mute y pueden hablar, pueden poner la cámara. Oh, now it's on. Ahora volvió el chat. We got chat back on.
Stunned into silence.
We have a question in the chat.
So,
That is in what region of Colombia exactly are you implementing or thinking and implement the zinc deficiency project?
So I was thinking mostly the poorest rural areas, including those surrounding Medellin or Buenaventura and the Choco region. So places like that. Then I was thinking of doing it locally first and then expanding it throughout Colombia later on, after I see how effective it is in the local rural populations.
Pero eso no está contenido en los lineamientos. Thank you, Harris. Laura Cerón said that also would be an excellent idea to implement in La Guajira. That is a region, a department here in Colombia that has many problems related with malnutrition, right? Okay.
All right, so I will go ahead. I'll make a quick comment. Oh, Stephanie has a comment. Roxana, do you want
to? Stephanie is asking if the rice, if they have farming in Colombia. Is it easily accessible in Colombia?
So the rice was a project for vitamin A deficiency, not for zinc. Zinc deficiency, they have supplements, but the main projects involve are barley based, so they grow barley and they add other stuff to it. And because of the lack of protein intake, and people don't know that protein is needed to help absorb zinc, and due to poverty and like being unable to afford meat and other products, this is why it's quite prevalent in rural areas.
And they have follow-up questions about, is it accessible? Is it very expensive?
So the current available schemes that they have are quite subsidized, so they're accessible to quite a few people, but not everyone knows about them in the rural areas. So that's why I was thinking of doing an awareness campaign, and therefore more people will be able to know about these schemes. It would help me.
Thank you. And then we have, so sí es accesible, pero no todo el mundo lo conoce, por eso el programa se enfoca en subir el conocimiento que existe. Y one more question about how would you approach the education programs?
So, so just teaching people about where to access the the different nutritional supplementations that are provided by the government, and maybe like showing them photos of the effects that zinc deficiency can have, without making it too complicated for them to understand. And I think because in the UK, even so, around 49% of people have a vitamin D deficiency due to a lack of sunlight exposure. Not everyone knows about this. So the government also highlights this by encouraging people to go outside more, for example. So I'd try and keep it quite simple for people to understand. And
Harris comparte que el programa sería mantener la mensaje simple. Da un ejemplo que en el Reino Unido hay muchos individuales que tienen bajos niveles de vitamina D por falta de acceso al sol y el tiempo. Con eso, entonces, el gobierno en el Reino Unido hace un mensaje simple de que salgan afuera, salgan a recibir un poco de sol. Y entonces, eso es un ejemplo de la manera que él usaría la campaña de educación. Thank you, Harris. Yes. Votar. Voting.
Okay. No. We've got 10 votes so far. We'll give it another 30 seconds to vote. Otros 30 segundos para votar. All right, as the votes are coming in, we've got about 21% that would fund at 100%, 50% that would fund at 50%, and 27 that would not provide funding. Good job overall. All right. Mouth care in stroke. We had this presentation. Is that you, Pablo?
Yeah, I'm just trying to see if I can share my screen. Okay. Disculpa por haber llegado tarde. Acabo de volver del hospital. I'm sorry I'm late. I just got back from the hospital. All right. So oral health in stroke. So have you ever thought, or have you ever been frustrated when you go shopping that things, you go for 2 or 3 things and they're everywhere on the store, and you need to go from one place to the other corner, and you can't find what you're looking for, or you ever walk into a room and forget what you came in there? Does that sound familiar? ¿Alguna vez se han sentido frustrado por haber ido a comprar 1, 2 o 3 cosas y al final tienen que ir a distintas partes de la tienda para conseguirlas y se terminan olvidando qué era lo que estaban buscando y cosas así, o entran en una sala y no saben qué es lo que están buscando? Bueno, si es así, no se preocupe. Don't worry about it. You're not alone. When it comes down to mouth care and stroke, that's something that's very similar. And I'll go back to what I asked earlier in just a moment. But with stroke patients, is something that often happens and often can happen when there's too many things going on and you forget 1 or 2 things. And mouth care is one of the things that that suffers when it comes down to stroke, because there's so much going on that the people, the carers, the nursing staff, the doctors end up forgetting to look after a patient's mouth care. And poor oral hygiene has been linked to several conditions such as sepsis or endocarditis. And with patients that have stroke, it's often they often have difficulties or they develop difficulties in swallowing and speaking and moving their mouth, and altogether this will lead to to poor oral hygiene as well. And that poor oral hygiene, there is a strong correlation with the risk of developing pneumonia. They can also, I'll stop there, sorry. Con el cuidado oral en los pacientes con ACV, a veces es parecido a eso. Hay tantas cosas que les pasan y necesita que o los doctores, las enfermeras o los que están cuidando, puede ser que se olviden de ayudar con el cuidado oral. Y falta de higiene bucal está relacionada con varias condiciones graves como la sepsis o endocarditis, pero en pacientes que también tienen un ACV puede ser que tengan problemas con neumonía, porque cuando pasa el ACV pierden el control de la boca, es más difícil tragar, es más difícil hablar y moverse, y también junto con eso y junto con una falta de higiene oral les pone el riesgo más grande. Pero también tiene otros problemas. So the problems that we can have with mouth care, as I mentioned, increase risk of pneumonia, also decrease nutrition and decrease participation in meaningful activities, which all in all will lead to increased length of stay, increased use of antibiotics, and poor patient experience on an overall very unfortunate experience of having a stroke. La falta del cuidado bucal puede, como mencioné, puede aumentar el riesgo de neumonía, también la duración de admisión a la sala de ACV. También aumenta el uso de antibióticos, disminuye la nutrición del paciente, puede disminuir la participación en actividades significativas para el paciente y sobre todo les puede dar una mala experiencia durante el tiempo que estuvieron siendo cuidados. Y algunas de las, pero sería fácil de arreglar esto si tuviéramos un buen cuidado vocal. This would be quite easy to take care of if we could have a good mouth care plan. Unfortunately, there are things that happen with, or that can happen to actually prevent this. One of these is the equipment. A lot of the time, the equipment, loads of little swabs that you bought and loads of little toothpastes and lots of little things. But all of these are kept away from the patient and they're all kept in different places. Also the patient, you can have, they're unwell. So they'll be spending a lot of time sleeping. A lot of time they will have decreased sensation and won't have the ability to actually, they won't notice that something's wrong, or they won't have the ability to actually express that something's wrong. And then you have the staff. The staff might not be aware of the patient's needs because they're either unfamiliar with the patient, or they don't want to disturb the patient, or they're unfamiliar with the ward, so they don't know where the stock or the equipment is kept, or they don't know how to use the equipment. So, and also it comes out when you have staff that are trying to complete other tasks, like for example the therapist or the speech and language therapist. Their goal is to teach the patient to swallow again, but they first need to end up doing mouth care tasks rather than actually be able to do their job.
Pardon the interruption, you've got 30 seconds.
Oh, okay. I'll carry on in English for that. So in terms of what we have is an innovation of a all-in-one pack that has everything that's kept by the patient's side. Bedside is easy to see, easy to spot, and what we can, and it sets a schedule mouth care routine for the patient and to make sure that it's good. The improvements in quality that we will use, and I can go through them in a little bit more detail, improves the patient's experience, nutrition, and participation in meaningful activities. Staff are happier to help. It decreases the chances of aspiration pneumonia and use of antibiotics, and it decreases the length of stay and the cost of care, which, of course, to complete this, we want to run a trial that's for 1,000 patient days. It will cost between 10,000 to 12,500 pounds. That's for the equipment, the training aids, and the data gathering and implementation. Hopefully from this, we can then move on to implement it a little bit more and look at if we can source for local suppliers for something similar or carry on with the same thing. Any questions? Thank you.
Great job. Muy bien trabajo, Pablo. Let's open up, see if we have any questions or any comments. I'll just say, I love the idea of the bundles. Bundles are wonderful and great to get the work done. That's key, bundles.
Yeah, I like I've seen this in another hospital. I really like it because it's there for the patients to use and for the staff to do it. So they can go and just open it up. Everything's in one place. It's right there next to the patient rather than having to go and then come back and then forget, oh, wait, I forgot to grab that part and then come back. And so it's sort of helpful. La clave.
So let's see, any comments or questions? You guys can unmute yourselves and ask or put it in the chat, puede poner en el chat o preguntar.
Is that a question? ¿O es una pregunta lo de
A question?
la clave del paquete para que se haga el trabajo o el servicio?
No.
No.
Oh, so that was me just trying to translate what I said, but I didn't do it well. It was just saying that having the bundles is key to getting standardizing and to make sure that work is done, you know, whether it's oral care or whether really any other type, the bundles is key in standardization.
Thank you, Tran. So the idea is not for every patient. The idea is for those patients that can't express and do these things. Sorry, I should have mentioned that earlier. So that we ensure that's done by, the packets are a 24-hour packet. They're scheduled, they have 2 for actual brushing the teeth, and the rest are for mouth care, sort of like freshening up the patient's mouth or making sure that there's no things like candida or other things like that by cleaning and making sure that the patient's hydrated. So this is done on a regular basis. So because it's a 6 element, so every 4 hours or so, or during the day, let's say the patient has 16 hours awake, 8 hours of sleep on the ward during those 12 to 16 hours, then we put those packets to be there to be used during that time. So it'll be on a schedule thing, and we can implement it so that they come with a sticker that then you can put on the nursing or the care chart. That way it's easy and doesn't take a lot of time, and it can, or in the patient chart, can be put there as well.
I believe Professor Joe has his hand up.
Yes, I was just trying to look at it initially that whether such thing has been in existence before, and yes, also you mentioned so that's been done in another hospital. So the question now is that what is the originality of this particular project?
So it's not so much an originality point of view, it's more of like something has worked somewhere else. Why should we not try it somewhere where there might be a gap? One of the things that they found with the project that they did is that they reduced the risk, that they reduced the use of antibiotics and ended up reducing the cost of care for those patients and the length of stay, which offset the price of having a little bit longer, paying a little bit more for a product because everything was there. The staff were also happier because everybody was able to use the package. Everybody had the training. I don't think that everything needs to be necessarily very original, but if something works somewhere else, it could be applied in a local setting where this isn't where it isn't done, to see if either costs can be cut down, patient experience can be improved, and participation of staff in the care of everybody can also be helped. Do you want me to translate that?
No, I'm okay with English.
Oh. No, I'm just saying for everybody else.
Okay, for other people, yeah.
So, la pregunta fue, ¿por qué dónde está la originalidad de lo que estoy diciendo? Porque se ha hecho en otra parte. Y la verdad que sí, fue hecho en otro hospital y lo he visto, y hay estudios también que se han puesto. No es original, lo que es agarrando algo que hemos visto que funciona en otra parte y tratando de implementarlo en un lugar para ver si puede ser que funcione aquí con nosotros o en un hospital en Colombia. No es para el uso de todos, pero lo que puede ser es que pueda ayudar a bajar los gastos, aun si el proyecto cuesta un poquito más, de bajar los gastos en antibióticos, por cuánto tiempo los pacientes están admitidos en la sala, bajar costos en otras áreas que después terminan ayudando a que el paciente también tenga una mejor experiencia del cuidado y que, estoy olvidando las palabras, y que también entonces el paciente tenga mejor cuidado, sea más barato cuidarlos, estamos usando los antibióticos de una manera mejor, y también el personal está un poco más involucrado en el cuidado del paciente en otras cosas. Any other questions?
All right. If no, then I think we can move to the voting.
Thank you.
Por favor, si pueden empezar la votación. I'm telling you, next time I'm putting the Jeopardy music in the background.
Oh, I can go. Do, 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 do.
All right, we're getting some good responses for you.
Amazing.
In Pablo, sorry, I'm reading your name incorrectly. Right, another 15 seconds. Unos 15 segundos más. Okay. So Pablo, congratulations. 80% of the respondents would fully fund your program.
Muchas gracias. Thank you.
13% would not fund it, and the remainder of 80 and 13, which I'm not going to do math live, is would fund you at 50%.
Amazing. Well, thank you very much.
Absolutely.
Muchas gracias.
Well done. All right, I think did we miss another one? Let me see. Pollen warning systems.
That was Amy who could make it.
Okay.
So we're done.
So I think we're done. I added an additional question here. All right. So we're going to do a word cloud. All right. So for this activity, whether in Spanish or in English, please provide a one-word response. What do you think of this Shark's Den activity? How would you describe it? Por favor, con una palabra en inglés o en español, si me pueden describir qué es lo que piensan o qué es lo que opinan de esta actividad del Shark's Den, en la manera en que se ha destacado. All right, and we can see words appear as you type them in. All right. Got a lot of interesting. This is good. All right, I'll give it a little more time. We've got 15 responses so far.
Los estudiantes, students.
Type in how you would describe it.
All right, we're going to do one more minute. Okay, so thank you everyone for this this word cloud response. And I think this is the end of our presentation. So Dr. Hernandez, I'll bring it back to you.
Awesome. Well, thank you everyone for participating, for the presenters, for the questions and comments and engagement and participation in these various events that we have had. I hope that everyone was able to experience a little bit and learn more about health in terms of other systems, other regions, other cultures. Gracias a todo el mundo por su participación en esta de una de las encuentros que hemos tenido. Espero que todos hayan aprendido un poco más de la salud en diferentes regiones, en sistemas de servicio y en los encuentros que hemos tenido. And I'm going to open up to the faculty for final words or any other students as well.
Can I just say thank you to everybody for buying into the Sharks Den. I thought that was yeah, really much gracias for that. So it's been so helpful for my students and hopefully for everybody else. So for that activity, and I suspect my face is still bright red from the dancing. It'll probably still be this color tomorrow.
And I'm putting it in the chat. Lo estoy poniendo en el chat. Thank you.
Yo. Bueno, también muchas gracias a Ivonne, a Nicki, a Joel, a Jessie, a todo el equipo de profesores y todo el equipo de apoyo que ha estado en esta actividad, a los estudiantes, por supuesto, de las 3 universidades. Me siento feliz, ¿verdad?, de haber compartido, de tener esta oportunidad de estrechar estos lazos entre las 3 universidades y que, bueno, pues, esperamos seguirlos fortaleciendo. Thank you so much to Nicki, Ivonne, Joel, Jessie, all the team that have been supporting these activities, to the students from the 3 universities. I'm happy today. I'm happy because of the opportunity to be sharing with you today, showing this carnival representation, all the presentations, everything. So thank you so much for everyone, and I hope we continue sharing, learning in the future. Thank you.
Thank you everyone for the opportunity to participate in this program for interaction. So it has been a learning opportunities, and I hope that we keep it going, and we be able to even expand it more as we move on into another year. Thank you.
Okay.
All right, everyone. Thank you for joining us. And you have the rest of your afternoon to do your thing.
Yes, thank you. Thank you, everyone. Thank you, students. I know a lot balancing act to get here across time zones. We appreciate you.
Bye,
Nos
everyone.
apreciamos a todos. Gracias. Bye-bye.
Muchas gracias. Thank you.
Bye. Ciao.
Bye.
Bye.